Department of Health recently dismissed claims that the government is neglecting growing cases of children falling ill from suspected poisoned food. Several children have died in separate incidents after being reported to have eaten food from spaza shops. Some political parties represented in Parliament have since called for a focused investigation, describing the incidents as a growing threat to the public health. To discuss some of these challenges that are currently confronting food safety, I'm now joined by Professor Lucia Anelich, who is a food safety expert. Prof, thank you so much for your time and for joining us this afternoon. Now, you just came back from a conference that focuses particularly on this issue that we're speaking about now. And there's been a spate, like I mentioned, in the recent incidents of food poisoning among children eating snacks, particularly from spaza shops, and some students having food from street vendors. What trends have you observed?
Yes, a very good question, and good afternoon to you and your viewers. The trends are, generally speaking, still that microbiological foodborne disease still remains the #1 type of foodborne disease that one sees. The chemical foodborne disease aspects are far easier to control, especially in the formal food chain sector, where you have all the checks and balances right from the beginning, from the farmer, commercial farmers in particular, through to the procurement, to the transportation, to the manufacturing, and eventually to the product being sold on retailer shelves. So there are, besides regulations, there are other best practices and guideline documents and standards that the industry adheres to.
So, I mean, Prof, you speak about microbiological aspects within the food. Just talk to us about what are some of the common causes of food poisoning in these scenarios. Are there specific pathogens or contaminants that are frequently responsible within these foods that these children consume?
In terms of the children in the informal settlements, that could be anything. But the most common is salmonella, and there are around 2,600 different types of salmonella. Not all of them are equally poisonous, but there is quite a spate of them that are poisonous to humans and can cause severe foodborne disease. Most often, one does not die from salmonellosis, but there are instances where vulnerable sectors of the population, like immunocompromised people, very, very small children like babies that are far more susceptible, and it could be quite severe for them. So the infant formula industry, for example, pays specific heed to salmonella amongst other pathogens that could severely affect newborn babies and babies in their first few months of life.
A little later, Prof, I want us to unpack just the vulnerable populations that you've just touched on. But maybe just in the interest of our viewers, should we be able to differentiate between food poisoning and food that has gone bad? And is there a difference between food that's contaminated and food that has deliberately been poisoned? Is there a difference, and should we be wary of such?
Yes, well, food spoilage, food that's spoiled and that's gone off, as we often use that term more commonly, is food that you can normally see is not good for human consumption. You can either smell that it's gone off, you can see sometimes bacterial growth or a mold growing on the food, like an orange or bread or cheese. Sometimes you see the mold, in which case you wouldn't eat that food specifically. So those are things you can see or taste, and maybe there's also a change in color of the food if it's spoiled. But food safety, unfortunately, the one that actually harms you is the one that you cannot see, you cannot smell, and you cannot taste, that the food is unsafe for human consumption, especially from a microbiological perspective. If it's a chemical that was added to the food, and you mentioned deliberate. Well, when there's a deliberate addition of a toxic chemical to food to intentionally hurt people, we call that intentional adulteration, meaning that this is a substance that should never, ever have been associated with that food under any circumstances. And so someone has gone and deliberately added it for nefarious reasons.
So, Prof, when we then speak about immunocompromised, vulnerable communities, you mentioned children, and we are seeing that in many of these instances, it's children, it's young children, it's scholars who have consumed all these types of food and are the ones that are more susceptible to some of the impacts of those foods. Would it be the same if adults were to consume these foods?
Well, if we're talking about what we currently see, which is potentially a pesticide, and it appears to be aldicarb, although we do still need all that confirmation from the authorities, it is a highly, highly toxic substance. So obviously a child would need less of that substance to cause harm and death, whereas an adult would need a little bit more to have the same effects. And with these kind of intoxications, there comes a point of no return. So there is a substance you can provide and treat the individual with at a hospital. It's called atropine. But the problem is if you go beyond a certain point that your body is starting to shut down, like your nervous system collapsing, there is very little you can do for that individual. And then the atropine won't even work under those circumstances, unfortunately. This is a specific case of a toxic chemical, which is pretty ugly and should never have been there because it's illegal in South Africa anyway. When we're talking about a microbiological food poisoning, it is definitely slightly different.
So then, Prof, why are we seeing this spur up across the country in different provinces? If it's a pesticide, are we saying that almost all of these puzzle shops are using the same type of pesticides that are then affecting children in the way that they are?
Well, that's the big question, is how broad is this problem? And is every single one of these poisonings that we are seeing attributable to the same product that was brought into the country illegally and has been supplied across the different provinces to these shops, to these spaza shops where we're seeing these problems occurring? Is it an established illegal supply chain? Where does this product come from? From which country is it coming into our country? How is it getting across the borders? So there are a lot of questions, I think, that the Department of Health, and I'm sure that the Department of Health, together with the police, is now investigating, because we need to get to the bottom of this.
We certainly must. Let's talk about regulation and oversight. And you mentioned earlier that the formal food sector is a lot more controlled from the farm to the plate. We know the standards and what is needed in terms of the food to be of a specification that people can consume. How well are puzzle shops and street vendors regulated in terms of food safety? And what gaps do you think exist in the current regulatory framework?
Coming firstly to the current regulatory framework, there are very few gaps in there. And one of the most important pieces of legislation that we have is the so-called Regulation 638. That is all about basic hygiene, how to transport food in the correct manner, the number of toilets you should have accessible if you want to run a food shop or a food business of any sort. And it's also colloquially known as the Certificate of Acceptability. Every single food premises must have a COA, Certificate of Acceptability. And this is provided by the local health authorities. And it's important that those inspectors actually get to those stores to be able to inspect them and to either issue the COA or not. So in terms of the formal food sector, this is done quite often. And it's also displayed so people can actually see that a store or a food preparation facility actually has such a COA. So that's the one thing that communities can look for. But unfortunately, there are two sets of rules, and we shouldn't have two sets of rules because we're all consumers of food. We are all South Africans. Regardless of whether we're poor, middle income, wealthy, we all have a right to safe food. So there must be equal enforcement of the law across the board.
Speaking on that, Prof, in terms of the COA, do you find that maybe there's a lot of red tape or even it being an expensive exercise for a small informal vendor on the street to be in possession of such a certificate? Why do we find that in most cases there wouldn't be a COA when people are preparing food and therefore food is not prepared in the best way that it should be?
Well, that's the question we do need to ask our health authorities, especially in the local municipalities, because there are some that are far better inspected and others that are not. So there isn't this equality across the inspection, across the provinces. It's a lot easier to inspect a structure that is more robust, like a brick and mortar structure that will not move from day to day. When you are preparing food in a small shack that you can just collapse tonight and move on to another spot, that's far more difficult to control because everything changes. The environment changes, the waste, movement of waste or removing waste might change. The accessibility to potable water might change. So those things are all encompassed in this certificate of acceptability. And if a food vendor is moving around, that's far more difficult to control.
Of course. So with that said, Prof, what role does public awareness play in preventing foodborne illnesses, and how can communities then be educated about safe food practices when purchasing from informal vendors?
It's absolutely vital that communities do become educated in the basics of food hygiene. They can look out very, very easily as to, are people washing their hands? Are they doing this regularly? Are they washing their hands after handling raw food and then handling cooked food? Are they washing utensils in between? I know this sounds onerous. I do understand that. But these are the basic food hygiene principles upon which food safety is based. We do this at home. So vendors must also be able to do that in public. And so these are the simple things that communities can look out for. You mentioned a conference, and one of the most interesting things that came out of this conference is that maybe we have forgotten that cooking is actually a perfect way of killing microbes. And it is. It remains an excellent way of cooking microbes. And the question asked by this individual presenting this paper was, should we not be reteaching people to cook and to cook properly? And that is one of the best ways of killing microbes that might be potentially in a raw food like chicken or meat or fish or anything like that.
And then, Prof, then how can food safety experts collaborate with public health departments to address these concerns, especially around food safety issues in informal settings?
The majority of food safety experts, including myself, would be very, very happy to collaborate with government, to assist, to help with all of these issues, because we are the ones that travel. We are the ones that collaborate with international groups. We are the ones that present at different conferences all over the world. And the world is interested in what we do, as we are interested in what they do, because food safety practices are constantly changing, although the basics never change, of course, like hand washing and so on. But it is something that we can all learn from one another. So coming back to South Africa and bringing back this information and also developing information from our own research activities in our universities is absolutely vital. And we are not often invited by government to actually discuss these issues with them. And we would be very, very happy to do so.
And why do you think there is that disconnect between the technocrats and government?
I'm not so sure that there is an intentional disconnect. I think it is something that, from a food safety perspective, food safety has not been a priority in the South African government. We don't even have a food safety policy for the country. Unlike many other African countries that I have worked with, they actually do have food safety policies in place. So that's the first place where we need to start working from. And then we need to place food safety in the forefront of government activities. The interesting thing is that the World Health Organization in 2015, which is already almost 10 years ago, determined that the burden of foodborne disease is as bad as tuberculosis and malaria. on a population. And this is the first time that the burden of foodborne disease was brought to the fore once these statistics were developed to show that it is as bad as tuberculosis and malaria, which are the issues we focus on a lot in South Africa, besides HIV, of course. But where is the focus then on food safety if it is just as problematic as tuberculosis and malaria?
All right. Thank you so much, Prof, for your time and those insightful words of wisdom with regards to food safety. Thank you for joining us. That's Professor Lucia Anelich, who's a food safety expert, speaking to us there on the back of the spate in the increase of food poisoning among children across the country.